Says going live on my end. Finally! I think I'm here. Can you guys hear me and see me? Hello, everyone. Can you guys hear me and see me? So sorry. Thank you all for sticking around for all of 20 minutes while we figured out some technical difficulties. Welcome to the world of not being a techie. I see that we have a bunch of people from California, New York, Oregon, Montana. This is fantastic. Thank you all for joining. If you have any questions, feel free to post them on the chat and I can start answering them. I'm going to start looking here real quick and making sure that nobody else has already asked a question. Great. I don't see any questions posted yet. I'm Dr. Lisa Rodriguez, internal medicine physician. I run Lipedema Warrior Clinic. This is a career out of love at this point, based on some personal difficulties that we experienced over the last 3 years. We ended up going down this path. As a internal medicine physician, I can diagnose lipedema. So can surgeons, family medicine doctors, pediatricians, if you have a child that's got lipedema. For the most part, for insurance purposes, they require that a medical doctor, meaning your primary care, your family doctor, your medical doctor, so internal medicine, be the one that diagnoses you first. And then from there, you can transition to going to see all the other subspecialists that you would require. We started this venture 2 years ago, and we finally grown to where we can provide services across 47 states to different men and women, although mostly 99% of my patients are women. You can see a vascular surgeon if you're so inclined, but insurances will not diagnose, accept a diagnosis from any surgeon. Most vascular surgeons can tell you if you have lipedema. Lipedema is really a diagnosis of looking at you and feeling you. It is not a diagnosis of testing or labs. So a lot of ultrasounds can help you find the nodules, but they do not tell you if you have lipedema. So the characteristics of having lipedema is a disproportionate distribution of your fat, where you have more fat distributed in your thighs and your calves than you would in like your chest and trunk. And then now we understand that it also can expand to the arms. And so women will have very large upper arms and then teeny tiny arms, lower arms compared to their upper arms. There are different kinds of adipose tissue disorders, which can be categorized in a different way. There are no specialty tests. So like there's no blood tests, there's no ultrasounds, there's no MRIs, there's no CAT scans. None of that is necessary to diagnose lipedema. Any internal medicine doctor that is aware of the disease should be able to diagnose you. It's a matter of just hitting the qualifying criteria. A lot of people don't feel comfortable diagnosing women because they're not comfortable with what the disease is. And that's, I think, a problem across the board that many women encounter, that unfortunately their regular primary care doctors will tell them, yeah, I think you have lipedema. You should go see a specialist. Same way, I think, for the most part, that they treat everything now in healthcare. You know, oh, I think you have heart disease, you go see a cardiologist. Oh, I think you're diabetic, you need to go see an endocrinologist, and so on and so forth. I think that's part of the reason why your regular doctor just doesn't feel inclined to diagnose you, and your vascular surgeon, it's not a vascular disease, so they don't feel inclined to tell you what your diagnosis is. It's kind of like asking your plumber to tell you that there's something wrong with your electrical. Even though they can tell you this isn't right, they don't feel comfortable giving you all the details. And I think that's why it's gotten to the point where most doctors are referring you to what's considered a specialist. That being said, your primary care doctor could become a specialist if they so chose to do so just by learning about the disease. Part of the reason why lipedema hurts so much is because, well, there's multiple reasons why. So the first reason is as you grow your normal fat cells, your fat cells kind of start like this, and then they get big and big and big, and then they got nowhere else to go. So you get another fat cell that gets big and big and big and nowhere else to go, and then another fat cell. And that's how you get all these kind of little blobs that look like a um, grapevine, a grape, like a little grapevine. In lipedema, that doesn't happen. So what happens in lipedema is you get a fat cell and then it gets big and big and big and big and big and it explodes. And when that explosion happens, it creates inflammation. It creates a release of cytokines into that matrix, into that goo that your fat sits in. And that is what causes the pain. As time goes by, that inflammation becomes more and more and more, kind of like when you first get a bruise and then it starts to hurt. Then you get the red, the purple, and then it goes away. In lipedema, that bruise feeling never really goes away. And then as you get more and more nodules in the lipedema, then those start to fibrose. They create a scar tissue. And just like any scar tissue on your skin, for example, if you cut yourself and it looks different, that scar tissue within your fat is not normal and it starts to pull in different directions, your muscles and your joints, and it starts to disform you. And this is why you'll notice that a lot of women, their knees look like this or they'll look like this. And it's because the lipedema is pulling them in different directions. And over time, that's part of the reason why it causes so much pain. There's also, as your fat gets larger and larger and that explosion happens, that cell can no longer get oxygen. So that's called hypoxia. And so part of the problem is that as you create this hypoxia, anything that doesn't get oxygen starts to hurt or starts to die. And so that process is also part of the reason why lipedema hurts so much. Granted, there are women who have abnormal fat deposition in their legs, and they kind of look like they have big stovepipe legs and then itty bitty ankles. And a lot of those women actually don't have pain. And there is a section of the lipedema world that's trying to differentiate the lipedema, which is the one that has pain, from the lipodystrophy, which is the one that just has an abnormal deposition without the pain. So that's still kind of up in the air right now. We don't differentiate it, but there is a faction of this world of lipedema that is trying to separate those two. So finding a specialist is not easy because there's not a lot of us that do this regularly. So for the most part, you can see, you can do a Google search. And you can find, a lipedema specialist. You have to be careful that they are not a surgeon. A lot of times, like even locally, we have that where they'll come up on the specialty list, but they're vascular surgeons, so they won't diagnose you, or they're a general surgeon and they won't diagnose you. So you have to just be kind of careful with where you find them, how you choose to engage with them, and make sure that they are like a medical doctor, for lack of a better word. There's a few of us across the country. I currently see women in 47 states. So I don't see people in New York, Rhode Island, Massachusetts, Pennsylvania, and West Virginia. That's it. Everywhere else, I can see people across camera. And if you guys need to fly and want to be seen in person, obviously we have an office as well that can do that. I know that there's a clinic that does it in Missouri, and I know of another one in California. I'm not aware of much else from a medical doctor perspective that diagnoses lipedema from a medical doctor. Is surgery worth it? That is a great question. I'm going to be frank. I never had lipedema surgery. So I'm not a lipedema patient. I've never had lipedema surgery. I can only tell you the experience of the women that I see and what they've told me. So my wife has had lipedema surgery and refuses to get another one. I have clients that have had 7 lipedema surgeries and are bigger than they were before they started. So the key in understanding lipedema is that lipedema is a disease of inflammation. Like I said, that's why it hurts. Remember, I explained the fat getting bigger and bigger. And we we recommend sort of working out your inflammation and figuring that out. We have a package ourselves that we promote in women. It's called the Clarity Package, which basically is designed to clarify the source of your inflammation. And your inflammation can come from internal or external environments. Internal are things like your gut, your nutrition, your genetics. External are things like the food that you eat, the clothes that you wear, and then things that can attack you, like bacteria, funguses, viruses, mold, parasites that can penetrate you and attack you and can cause inflammation. And those are important things to figure out, because if you go to surgery and you don't have your inflammation controlled, then you'll end up worse than before, because surgery is a trauma. And as a trauma, it's going to create inflammation. It's going to trigger your inflammatory markers to shoot up. Your lipedema is going to get worse.
Read Lori's question. It goes with it.
If Oh, sure. I'll discuss MCAS, Lori. So if I go to stage 2 during a pregnancy, is that my new stage, right? I can't go back down without surgical removal. Well, no, that's not correct. So yes, if you go up to stage 2, that would be your next stage. That's why the disease progresses. But it is not, surgery is not the only way to remove or get down on the stages. So right now, we can improve women's size and inflammation with medical treatment. And that's been shown at the Fat Disorders Clinic. There's a couple of surgeons and practices in Spain and in Brazil that do this. And with medical treatment, so with medications, we control inflammation, control triggers, and you can see reduction in the size of your fat, reduction in your pain, reduction in your dysfunction, and improvement in your mobility. So yes, you can get to a point where you're left with only fibrosis and nodules, and those I can't remove unless you go to surgery. But we can get you to where all you have left is lipomas and nodules, and you feel much better and much more comfortable in your own body. And you can go down in stages from just using medical treatment. So MCAS, so lipedema happens in, I think it's 11% of the population in one study. Another study says a lot less. Another study says a lot more. I think a lot of it just depends on how they're grading that lipedema and who's judging it. But for the most part, it's about 11% of the women can have lipedema. And in those women, there's about a 30 to 40% chance of those women also having hypermobility, also having mast cell activation syndrome, also having thyroid problems. There's actually an association with autism and ADHD. And there are women that unfortunately can have all of these things kind of put together, and that makes their care a bit more complicated. And those are typically the women that do not do well in surgery unless they've had their triggers controlled. And so if you control their mast cells, if you can educate their bodies on how to function with EDS, if you can manage their thyroid, if you can get their hormones controlled, if you can clarify what their triggers are and what is wrong with them, and you can fix all of that, then when they go to surgery, they do very well and do not have worsening of their lipedema. MCAS is called mast cell activation syndrome or mast cell activation disease. And your mast cells are basically absolutely everywhere in your body, everywhere except for dead things like your hair and your nails. But otherwise, everything's got mast cells. And your mast cells are basically like your fight or flight freeze response cells. They tell you you're going to die, or they tell you you're fine. And in people that have mast cell activation syndrome, it means that their bucket of fear of those mast cells just got so full that the mast cells are constantly activated, and they feel like they are always in that fight or flight freeze response. And the smallest little thing, like a loud noise, like somebody closing a car door, or a smell, you walk into a room and somebody's wearing strong perfume, or literally you just cleaned outside in the yard and you can get a trigger of an inflammation response, like a headache, joint pains, rash, fevers, nausea, vomiting, diarrhea. So there's a lot of responses that women can get for what would appear to be no apparent reason. And a lot of these women unfortunately get tagged with being crazy, or just it's all in their heads, because you as a doctor can't find anything wrong. But in reality, they have a lot of things wrong, and it's their mast cells are just hyperactive, responding to everything as if the noise from the car door closing was you being in a war zone, or the smell of somebody's perfume, you being in like being poisoned, right? And so that's how your mast cells are responding. And so your responses are exaggerated. And so what we want to do is we want to calm those mast cells and we want to get those responses down so that basic events of life, like surgery for your lipedema, don't end up creating a life and death response in your body. Your vascular surgeon did an ultrasound and everything was normal. He sent me to a lymphedema specialist because he had no idea what was wrong, but agreed something was going on. So that's, Melanie, unfortunately, that's a story that we get a lot. Huh? Oh, sorry. The lymphedema specialist looked at me and said, "This is stage 2." Okay. Okay. Well, there you go. See, I was going to say we get this a lot until you see the specialist and then they tell you exactly what it is and they send you to your primary care doctor. Unfortunately, there is no treatment for lipedema. So the treatment is control your inflammation. This is why, part of the process is figuring out your triggers. This is why a lot of what I do on a regular basis is help women understand their food triggers, their nutritional triggers, their nutritional stance, their gut microbiome, because that's a trigger, their dysbiosis, if they have things like SIBO, chronic fatigue, vector-borne illnesses like Lyme, EV, mold. We identify all of those things. We do genetic testing. We try to clarify what is the problem in you specifically, and we try to guide that process for you so that we can get you to feel better. And then that's how we can manage your lipedema. And your primary care could do the same thing if they had the knowledge on the tests to run and how to manage the responses and the results on those tests. And that's fantastic that your primary care educated herself and was helpful with conservative care. Conservative care is extremely important aspect of lipedema. Conservative care stands into MLD, which is manual lymphatic drainage massages. It stands in wearing compressions. Some women that have significant lymphedema can get pneumatic pumps covered by their insurance on top of the compressions that they wear. There's a couple of companies out there, and some of them have a portable one. I have patients that like travel for a living, and travel is very hard on women with lipedema because of the changes, the barometric pressure changes, and even just the being in a confined space in that airplane changes your physiology as a normal person without lipedema. So when you have lipedema, as a normal person with lipedema, your lipedema gets activated. And so I have patients that have a little travel pneumatic pump that they use on top of their compressions when they travel. And so a lot of those things are conservative treatment that can be very, very helpful. There's also supplements that are recommended in women with lipedema. That can be helpful. A lot of it is just kind of dialing down what each person needs with individual kind of precision care, precision medicine. Is there a test for MCAS? Yes, there are a lot of tests for MCAS. One very common test that a lot of doctors prescribe, and then they believe that if that test is negative, you don't have MCAS, is that tryptase level. That tryptase level is originally the way that mast cell activation syndrome was diagnosed. And that was way back in the initial stages of mast cell activation disease, where mastocytosis, which is an actual abnormal growth of your mast cells, and these patients that have this disease can actually develop a malignancy like cancer from this type of mast cell activation syndrome. That's what's in the books. That's what I learned when I went to medicine and residency and everything else. And it's about 4 lines of a book that's about this thick with 5 million pages, and that's literally what it says. Elevated tryptase, mastocytosis, these people get cancer, they got to go see an oncologist. And that's all we know, and that's all we knew. And over time, much like things like autism spectrum disorder and a lot of other spectrum things have changed, we now know that there's a other consensus. So there's other criteria. There's a consensus 1, which is that mastocytosis old school thought process that if your tryptase is up, that's it. And then there's consensus 2 criteria, which believes that there's more than just that tryptase level. And in those patients, That's the following that we test for, and we can do blood and urine tests that are and can be abnormal. You also have to have a complete questionnaire with a bunch of positives, and then you have to get better with treatment. So you have to meet certain criteria if you're using the consensus 2 to be qualified as having mast cell on that consensus 2. So that's the way that you said here. Somebody asked if you could test for mast cell, and that's how you do it. So yes, there are tests. They're run by 2 labs, and when you order them, you actually have to be very specific, because a lot of regular labs like LabCorp or Quest, they don't run these tests very frequently, so they don't know what to do. So when I order those tests, I send a big spiel on what you're supposed to do. I order those tests frequently. I'm part of the believers of the consensus 2 criteria. So when I see my patients that I believe have mast cell activation syndrome, I run those tests and then I treat them, and then they answer the questionnaire for me as part of the process. The best way to reduce swelling. The best way to reduce swelling.
Is there a connection between lipedema and hypermobility?
Oh, yes, sorry. I missed that first question. Is there a connection between lipedema and hypermobility? Yes, 30% of women in the lipedema world can be hypermobile, but you also have to understand that 30% of the population, general population in the entire world, can be hypermobile without having hypermobility. For example, I have one shoulder that's hypermobile, and nothing else. That doesn't qualify me for having hypermobility. So there are certain criteria that you also have to hit for that hypermobility, kind of on the Ehlers-Danlos syndrome diagnosis. And that's also a base of questionnaires. There is a genetic test that you can do, but we know now from years of understanding EDS that it's much like autism spectrum disorder and MCAS consensus 2. It's that there is a spectrum of EDS that doesn't fall into those 14 genes, and you don't have to be homozygous to actually have excess hypermobile joints and hypermobile or hyperflexible skin. You can be heterozygous with those genes. And so when you test for genetic EDS, you only test for homozygous and 14 different abnormalities. And there's a lot of people that don't fall into that. I don't recommend testing because it's super expensive. I think it's like $3,200 or $3,500. And it's useless because you can't do anything with it. There's no help with getting tested. So I don't have people waste their money. Insurance doesn't cover it. And it doesn't help me diagnose you. Just going off the ticker and the questionnaire is sufficient. And a lot of women that have hypermobility just need to change the way they exercise. And that's a very important aspect of hypermobility, is understanding the limitations that you have to have with your joints. The best way to reduce swelling, Cynthia, is through a very personalized and precision diagnosis of your inflammatory markers. And so you can try diasmin, you can try exercise, you can try step-bound, you can try an anti-inflammatory diet. I'll tell you my experience is that in an anti-inflammatory diet, my wife was following it. And when she got her food sensitivity testing, everything that she was taking that the internet says is anti-inflammatory was making her 10 times sicker, because she was responding to all of them. And those were her triggers when we did her testing. So personally, I do not recommend any fad diet, any anti-inflammatory diet. I do not recommend random usage of supplements. Because I don't know what truly is affecting you. So the way I like to explain it to patients is I want to know precisely what's wrong with you, and I get that through testing, and then I can move those tests and move the needle in the right direction for you to get you to feel better with what you need. So that is the best way to reduce swelling, is through a clear picture of what your inflammatory triggers are: food, gut, external, internal infections, your genetics, and your nutrition. I believe very, very strongly that a big picture of everything that's going on with you is the best way to manage inflammation. Yeah, see, Anna and Penley, I'm so sorry. I get it. I've seen a lot of women like this: 3 surgeries, calls, thighs, calves, thighs twice, knees are shot. You're still in terrible pain. You wear a Nike and you're not better. And you just need to figure out what your triggers are. You know, shoot us an email, give us a call, book an appointment. We can work on your inflammatory triggers. We can get all the testing done. We have a very comprehensive package that gets your gut microbiome, gets your food sensitivity, gets your nutritional status, gets your genetics tested. And I don't test genetics for disease. Let me just be clear. I don't test to see if you have BRCA gene. I don't test to see if you have EDS. I don't test to see if you have heart disease. I test to see how your cycles for managing nutritional elements and minerals is processing. I'll give you an example. It's this famous MTHFR gene. All of you know it. MTHFR. Oh, do I have the MTHFR gene? Yes or no? So I tested myself for the MTHFR gene and I do not carry it. I'm heterozygous, which means according to the MTHFR world, I do not have MTHFR. When I did my nutritional assessment, my labs were so bad. I mean, so bad. My doctor said, "How are you standing in front of me right now?" And I was like, "I don't know. I'm just standing here. Like I don't know. This is just me, right?" My wife thought that those labs belonged to somebody else. That's how bad my numbers were. And when I ran my genetics, it turned out that, yeah, you're right. I did not have the abnormal MTHFR gene, but the MTHFR cycle has 6 steps in it and the gene is 1 step. I had 5 other steps that were bad and not the gene. So I wasn't methylating any of my B vitamins, no B12, no B6, no vitamin C. I wasn't absorbing them and I wasn't methylating them, even though my MTHFR was negative. So this is why I believe in getting precision care so that, see, now I take supplements with methylated, 4 different forms of methylated vitamin Bs, B6 and B12, methylated versions, and I consume a natural form of vitamin C that I can absorb and I can change instead of the vitamin C pill, which I do nothing with except for get diarrhea. So that's how the genetics helps tremendously. Um, so vibration plate. I just saw somebody mention that they use a vibration plate. I want to be very clear. Some women with MCAS can have really bad side effects to vibration plates. So before you buy a vibration plate and spend that money, I recommend that you test one out somewhere, either at your gym or at a wellness facility. Those are readily available in a lot of states. Like we have one down the street. Get on it and see how you feel. If you get hives, if you get itchy, if you get hot, if you get swollen, if you get a rash, those are signs that your mast cells are hyperactive and you're not going to respond well to a vibration plate. And I do not recommend that you use it. Some women with MCAS that have this same problem with the vibration plate, they'll get like when their mast cells are not controlled, they'll get like a random rash from being in the car on a bumpy road, or if they're in an RV or something that's really shaky, like a bus ride, they'll get really itchy or they'll get a rash. That's another sign that your mast cells are not kind of well controlled. I'm not sure what condition you're talking about, Anne. Oh, I'm sorry. Yes, indigo. I did explain that, and there is a relation. So there's about 30 to 40% of women with lipedema that carry all 3 diagnoses: lipedema, mast cell, EDS, thyroid. All of those things kind of put together. And controlling the mast cells in those women does a lot for their lipedema. A lot. Like it makes them feel very, very good. Pain goes away, swelling goes down, and it increase even how often you go to the MLD therapy. Your inflammation's down. Basically, you're not putting as much gunk into your lymphatics, and you don't need them drained as often. If I have no issues with the vibration plate, would that point to not having MCAS? No, it does not. It just means that you don't respond to vibration, but you might respond to noise, you might respond to heat, you might respond to an external trigger like allergies could trigger it. You might respond to food. So MCAS is not just a vibration plate. I'm just saying women that have MCAS and lipedema just need to be cognizant of the fact that using a vibration plate can sort of cause that. But it doesn't mean that if you don't get a rash or a problem with the vibration plate that you don't have lipedema. They are not one and one.
Now, when you talk about the custom vitamins we can make.
Oh yeah, that's a good point. Angela's bringing up is my vitamins, my supplements are basically like I don't know. I think there's like 100 different things. I'm exaggerating. There's probably 25 different supplements in it, but it's pre-made. So I only have to take 2 capsules a day, and it's got like every single pill eh, supplement that I need. So I don't have to take, 4 vitamin Bs and a multivitamin and vitamin C and SOD and, all these other agents. I compiled it into one. And so we only take 2 capsules a day, and that's it. It makes life so much easier to be able to remember to take those. And we do offer that through, like, once we get your genetic testing done, then we can fix your supplements to just be like 1 or 2 pills instead of being like 27 pills or even 50 pills of what you need for your genetics. Yes, and there are some supplements that are designed to help your lymphatics drain. There are some supplements that are designed to help your metabolism. There's a lot of that. Yes, I'm sure you could find a million of those supplements, a million companies that'll sell you different supplements, and they help some people. They might not help everybody. I'm just cautious with who I recommend supplements to and which ones, because I always want to know, mast cell activation syndrome patients can have responses to different supplements. Like, for example, our cycles can sometimes absorb quercetin, and sometimes they can't. So that's a big one that everybody talks about. Anti-inflammatory supplement is quercetin. There are women that their genetics doesn't absorb quercetin, so they buy something, and you're basically just spending your money for no reason. So this is again why I like to kind of point people towards not doing things blindly. I like to test. I like to know what I'm dealing with so that I know how I can actually help you and not just help random lymphatics or random metabolism or random, pains. Um, is the pituitary involved in a lot of these symptoms? Well, so kind of yes and no. So the pituitary is a feedback loop gland. So basically, in your hypothalamic pituitary adrenal axis, I always have to think about that one because it's a tongue twister for me. Your pituitary and your hypothalamic glands sort of manage your stress, your cortisol, your insulin, your DHEAS, your HSPG, and some of your sex hormones. And so, based on those numbers, then it sends a loop back, sort of feedback, and it tells the pituitary, hey, hello, activate me, right? And then that sends a message to activate the gland that then creates these hormones. So, for example, your adrenals make cortisol and they make DHEA, and they use pregnenolone and they use cholesterol, right, to make all these agents and turn them into hormones. But the adrenals got to get a message from somewhere. And that message is part of that axis from the hypothalamus and the pituitary. So, from that perspective, yes, the pituitary is involved in your flight or fight response, in your stress, in your cortisol level, in your DHEA. Very much so. I had a free 30-minute visit in what's called Exopod. It was an infrared light 2 therapy, pink Himalayan salt therapy, and a vibration plate. Supposedly, this helps with lymphatic drainage. So, red light therapy is super helpful for a lot of things, not just lipedema. Um, I think I know what the Exopod is. We might have had something similar. The one I've been in does not have the pink Himalayan salt. Yeah, I think that's kind of like the one that they have. We are members of like a wellness center, and they have something similar. They don't call it an exopod. Um, so vibration plates in general are very helpful for lymphatic drainage. So that's why the vibration aspect of it will help your lymphatic drain. Nothing is as effective as an MLD for lymphatic drainage. So you can do all the vibration plate that you want, but without MLD, you're not going to get the same benefits. There's a reason for that, and that's the technique. Is it takes a long time. It's an hour. It massages you in the correct way. The vibration plate just kind of shakes everything around to kind of loosen things and activate them. But the way the MLD is done is precise, and to bring the lymphatic drainage from down all the way up into the belly where you have most of your drainage to then feed into your veins. And so things like the exopod will definitely make you feel better. And if it works, that's great. Like that's fantastic. I recommend red light therapy for pretty much almost anybody. They should have that, just kind of be out and about. Everybody should have lights that come down with red light therapy because it's so helpful. I recommend, if you're going to do red light therapy, that you try doing it in the morning. Red light therapy inhibits your melatonin production naturally. So if you do it in the afternoon after 3 o'clock, you could be affecting your melatonin, making yourself kind of a little bit more excited than you want to be, and it could jack up your sleep a little bit. So try to use your exopod in the morning hours so that you have a better night's sleep later. Um, your Okay. Why are GLP-1s so effectively, especially when paired with ADHD meds? What's doing that to the cells? That is a great question. GLP-1s are extremely effective for a lot of things. And the reason is that as we have been sort of getting into these drugs, now I want you to understand, we've had GLP-1s now for about 25 or 30 years. The initial one was Victoza, which was used for type 2 diabetes, and it was a very specific and weak GLP-1. Over time, drug companies want more money, so they make different GLP-1s and they make them better and better and better, and then they start to notice things. So when we started to use Ozempic for diabetes, and that's been, I think, about 15 years, because the Ozempic uh, patent is expired, and I think those are 15 years long. So for 15 years, we've had Ozempic and we've been using it in diabetics. We started to notice that those patients over time just simply lost. And so their diabetes got better, but their numbers also got better and they lost more weight. And a lot of things of what they reported was that a lot of their desires, like that food noise, I want to drink, I want something sweet, I want some sugar, I don't feel full, those things changed. And so as we've learned more and more about GLP-1s, we know that there's actually GLP-1s on your mast cells. This is why mast cell activation syndrome gets better with GLP-1s, because your mast cells have GLP-1 receptors on them. So when you take a GLP-1, we started to notice that these women that were diabetic, or these men that were diabetic, they could come off their Oxycontin, their pain medicine, because now all of a sudden their joints don't hurt from taking the GLP-1. There's all these different things that we started to notice, and people just, pharmaceutical companies just start to study the data. Doctors start to study the data. There's actually data now that they tried using GLP-1s on drug addicts, people that had an addiction problem. And when you gave them the GLP-1, their brain stopped telling them that they needed to use drugs. They still needed the high, so they still wanted to go get high, but there wasn't that constant, hey, you got to go get high, you got to go get high. If they fell asleep and didn't remember to go get high, they didn't get high, and their incidence of usage of drug dropped tremendously. We know that people that drink alcohol regularly, when they go on GLP-1s, all of a sudden they don't care. They don't feel like they need it. They don't want to drink. And it's not a taste change. It's the way the GLP-1s affects all the different parts of the body. So the brain cells have GLP-1 receptors. Your mast cells have GLP-1 receptors. Your joints have GLP-1 receptors. And so because your mast cells have GLP-1 receptors, when you decrease your mast cell response, you bring down inflammation. And that's part of the reason why patients with MCAS that can be like thin and starving and they can't keep anything down in their gut, you put them on a GLP-1 and all of a sudden their gut dysbiosis gets better. They can eat and they can gain weight because the mast cells in the gut have calmed down. So part of the GLP-1 improvement with ADHD, with depression, with anxiety, with mood, with all that stuff is that because you have those receptors on different cells in your body, your brain cells have it and your mast cells have it. And your brain has a lot of mast cells, and there's studies showing now that your lipedema fat has a ton of mast cells in it too. There's actually a study that came out a couple of years ago showing that drugs used for mast cell activation syndrome actually decrease inflammation and swelling in lipedema fat and decrease pain in lipedema women when used, even if they don't have mast cell. So there's a lot of data that connects the mast cells and the fat and the lipedema and the brain. Do you believe skin and bone marrow biopsy is important? Lori, in the consensus criteria, we don't do skin or bone marrow biopsy. We do blood and urine testing. I'm sure that if you had mastocytosis, that they could diagnose you through bone marrow or skin testing. Yes, that would probably seem a bit extreme, but that's not something that I've heard of, so I wouldn't take my a definitive answer. I've just not heard of that before. MLD is manual lymphatic drainage massages. I apologize. Those are a special kind of very soft, gentle massage that's designed to guide the lymphatics up and kind of squeeze the lymphatic very gently up towards the core, which is where we have most of our lymphatic drainage. And if you want to reach out to discuss testing, we are readily available at any time. So currently, anybody who is interested, we do have what's called Clarity Package, which is the way that we like to kind of bring clarity to your disease. That's why we call it that. It helps me figure out your genetics, your nutrition, your food sensitivities, your gut microbiome, and your hormones. We can also tie that in with the use of a continuous glucose monitor, which we have found helps women tremendously figure out insulin resistance, and help a lot with getting control of their PCOS. Because once you know what your glucose and your insulin are doing, it's a lot easier to get control of metabolic diseases. So polycystic ovarian syndrome is PCOS. I apologize. And so we offer that package as a whole to any patient that sees us. If anybody is interested in booking that in the next couple days, we are offering the initial lipedema consultation visit free, included in the package. And I will post, because unfortunately, the original link I had, all this technical difficulties, I had this beautiful QR code that I can share. And I think I can still do that on my sharing my screen. I just need a second to do that. And if you scan the QR code, it'll take you right to booking. Yeah, so I will share my screen here for a second. There we go. I think you should be able to see that, maybe? No? Is it visible? No? Okay.
Okay, at the end, just say,
Is that better now?
hold on, it's catching up.
Okay. So I put the QR code there. I think,
It might show up in a little bit.
yeah, hopefully I can get it, but if not, I might be able to put the, I'll get the actual,
And you're gone now.
so here is the,
There it is.
okay. There is the intake. There's the booking. I just put the booking in the chat if you want to book, and then do GLP-1s lower desire? Indigo, do you mean like sexual desire? No, that has not been shown. What it does is it stops the noise. So like if you're a nymphomaniac, then yes, it would stop that desire. If you're an alcoholic, then yes, it can turn that down. People that are overweight from food noise, it's what we call it. Basically, it's that idea that I have to go drink, I have to go eat. When's my next meal? I'm hungry, I'm hungry, I'm hungry. That's what it turns off. So it does not affect your libido, for lack of a better word.
94.7% accuracy.
Yeah. I understand MRT is a bit controversial, whether it's validated or not. Yes. So all food sensitivity testing is controversial, all of it, validated or not. Now, the reason that we like the MRT test is because MRT, it stands for mediator response testing. And what that means is your mediators are, or your end mediators are, after you eat the food and you've consumed it, what spikes. And those mediators are histamine, catecholamine, interleukin, right? And so those three mediators are huge aspects of inflammation. So the reason that we like the MRT is not because we want you to stop consuming 20 foods, but because we want you to learn what those foods do to you. So I'll give you an example. My MRT was positive for tomatoes. And at first I was like, I eat tomatoes all the time. I don't know what it does. I'm not worried about it. I don't have lipedema, whatever. And so I don't have an inflammation. I don't have MCAS. So I consume tomatoes on and off. And then my wife got on me and she's like, you should stop. It's, you're creating histamine somewhere. You should go through the process and clean yourself out. And I did. I went through the educational process of a elimination reintroduction diet. And that's the part of the lipedema test, the MRT test, excuse me, that I think is so important is that reintroduction diet. So when I eliminated tomatoes for 6 weeks and I restarted tomatoes, I realized what it was causing me. And I was like, oh, well, I don't want that all the time. So now I know when I go out, if all they have is pizza, I can eat it, but I know what's going to happen to me in the next couple days or the next couple of hours. And it's a choice that I'm making with an educated response. That's the point of the MRT. My goal is not to have you eliminate a bunch of foods. My goal is to have you understand what those foods trigger and whether or not they are worth it to you. If they trigger a headache or if they trigger your migraines, are you going to want to eat tomatoes? No. There's a ton of other things that you can consume. You're not going to die if you don't eat tomatoes, but if you don't have a migraine for 2 years because you eliminated what was triggering that histamine response, you're going to feel a lot better. So that's part of the reason why we like it from a clinical perspective. It's being able to identify what the trigger it does to you is. I have patients, for example, that when they go through the MRT test and then they go through the elimination diet, reintroduction diet, they lose inflammation. So they start to see their legs get smaller and smaller and they don't hurt as much. And so then they're like, well, this is great. And then they go do something like walk their dog or expose themselves to the outside. And all of a sudden the legs get swollen again. And it's like, well, wait a minute, I eliminated food. What happened? Well, we don't know what you were exposed to when you went outside. So I don't want people to think that the MRT is the end all be all. It is one step of a very large process that you have to go through. This is not one shot, one drug, one test, one solution. This is a complete understanding of everything that goes into your bucket so that we can bring that bucket down to 20%. And when you're living at 20%, it's a lot easier, right? 4 years ago, before we had MCAS controlled in this household, the emergency were EpiPen and an ER because you needed to put a tube down your throat because you couldn't breathe. Now the emergencies are I ache and I didn't sleep too good because I overdid it with my cleaning in the yard and my MCAS got flared. That's very different. And so that's the 20%. So a lot of that comes from understanding your foods as much as understanding your environment. No, New York City is unfortunately, Laura, a very peculiar state. Most companies do not send kits to New York City. So MRT doesn't, Rupa doesn't. You are going to unfortunately have to go to Connecticut, Vermont, Rhode Island, Massachusetts, Maryland, Pennsylvania, Delaware, somewhere other New Jersey, if you want to get testing. New York State has very particular laws. It's not a matter of a license; it's a matter of the state laws. And I'm not sure why, but yeah, they do. It's an unfortunate part. Do I see people like myself continuous pain? The difference is your pain will go from 100 and it'll become manageable and tolerable, and then you can choose what you do. For example, I have patients who were not able to go to the gym because they could barely get off the couch from excruciating pain. And now they're able to walk their dogs and go to the gym twice a week. Do they have pain when they go to the gym? Yes. But that pain is no longer at rest. The pain is no longer from just cooking. The pain is no longer from showering. So the pain becomes a manageable, expected pain, not a constant, persistent, life changing pain that you can't think, you can't sleep. You don't even want to be nice to people because who the hell wants to be nice when they're in pain? So yes, that is the idea, is we get you down to where you feel better enough to go back into society and participate and not just want to like hide in a hole or crawl into a hole and hide. So, Laura, if you go to Connecticut, you can get testing. The testing that we recommend is pretty complete. So we do nutritional genetic testing. We do the MRT test for food sensitivity. We do a nutritional evaluation test that gives me pretty much like every level, omega-3s, vitamins, lipoic acids, like lipoic acids. It also measures like your uh, heavy metals. It measures some of your minerals. And so it's pretty complete. And then we also do hormone testing. So we check your DHEAS, your insulin, your HSPG, your thyroid, your testosterone. We check your triglycerides. We do your hypothalamic adrenal axis. So we order a slew of tests from the hormone standpoint. And then we also add, excuse me, a GI map. And that's a big one that you can get. And if you want, we can certainly, if you click on the link, we can certainly get that package sent to you and work with you in Connecticut. I'm not licensed in New York, but I am licensed in Connecticut, so we can see you and send that stuff to you in Connecticut if you're interested. We are a little bit past 5. I don't know if anybody else has any questions. If I can answer anything. I know that we're 20 minutes late, so I'm happy to keep going if there's more questions. Michigan, yes, Anne. Like I said, I'm only not licensed in New York, Pennsylvania, Massachusetts, Rhode Island, and West Virginia. So 5 states, I'm sorry, go to the nearby state and I can see you. All other 47 states I am licensed in, and I can to any and all of them. I have compounding pharmacies that work across even Hawaii. I just saw a patient today from Hawaii. I got a compounding pharmacy that can get her all her meds that she needs. I work with 6 different compounding pharmacies to give patients across all 50 states, although I'm not licensed in all of them, but the pharmacies can provide. I can cover all 50 states, and all the testing can go to all states except for New York. Even Hawaii, I can get the testing there. Yes, Laura, if you yeah, if you have a Connecticut address, we can send the packages there. Yep. So we can send everything there. So if you are interested, the tests are completed through blood draws, saliva, and urine. So the blood draws, you have to go to a designated place that can do it. And all the kits have a little website that you go to, and it tells you where you can go get blood drawn. And then the urine and the saliva, you just fill out, freeze, and you send. Laura, I think it's just easier if you click on the link and book the appointment, and then we can go over all the information at that point. I think I can pin that. I pin that message for the link, so that it's always there in the intake. The link isn't working. If you copy and paste, I will check it myself, but if you copy and paste it, it takes you right to, yeah, if you just copy and paste it, it takes you right to the Lipedema Warrior Clinic, choose an appointment. It takes you straight there. So just copy and paste the link is the best way to do it.
Do you have the QR code? You can put it up.
Yes. It showed up at some point. So I will put up the QR code again. Angela said that it showed up after a while. And then I guess maybe it's just a little delayed. I do want to make sure that everybody understands that the information provided here, I'm not your doctor. This is for not for medical purposes. I'm just helping you guys educate you and understand what lipedema is, and how you guys can feel and get better. So I do have to make that disclaimer at some point during this talk. I'll see if maybe now that I'm sharing that slide for the QR code, if it'll come up. Yes, the IntaQ link above, if you copy and paste that gets you to our website. You can book an appointment, and that way you can book the package. The package comes with all the follow-up appointments, We offer, I think it's 8 appointments plus the 12 if you get on the 360 for the CGM. Otherwise, we walk you through every single test, every response, every result. We even do meal preparation type samples for you, recipes, everything that part of the MRT. We do that. You know what?
A lot of the home ones will.
Melia, a lot of the home ones do go rural. LabCorp, I don't believe does it from the last I checked, but sometimes LabCorp is willing to freeze and ship. Um, but if you connect with us with an email, info, I'll put that here as well, info at Lipedema, warriorclinic.com. I'll send that here. Shoot us an email and we can try to figure out if there's, with your email address, with your address or something, if we can figure out the the labs and the booking. The other thing too is that we do offer payment plans with our packages. So if the initial payment seems too overwhelming right off the bat, then we do offer payment plans where you can pay monthly for 4 or 5 months to kind of get yourself in the process and at the same time get your testing done and start to get better and feel better as we're doing the testing. You're welcome, Cynthia. I'm glad that you found it helpful. If that's it for everybody, I'm not sure if the QR code has popped up or not, unfortunately. Angela says, hang tight, it'll pop up. Well, if there's no more questions, I am happy to let you guys go. I've posted our link, our website, and our email. I will leave the QR code open in case somebody decides that it comes up and they're still on and they want to click on the link. It takes you to the same place. We are going to be doing these every month. I forgot to say that. So every month we're going to be doing a live Q&A. If you have more questions, anything else that comes up while you're in the process, we are going to try to do these every month to keep educating people. As we get deeper and deeper, then we are going to kind of bring a few more educational points to the table and not just wait on questions. This way, if you've been on them before, we're offering something new every time and not just answering questions. And we are going to start doing some educational videos as well on YouTube. They might not be me in person. It might just be educational content, but we are going to start posting a lot more educational content about a lot of these things to kind of explain them a little bit more in depth as far as diet goes, exercise goes, exercise with EDS, exercise with mast cell, recovery time, the hypoxia, a lot of those things that I talked about, the pathophysiology of this disease is we are hopefully going to start posting some of those educational videos on our YouTube channel and on our Facebook page so that we can continue to educate and empower you guys to just kind of manage your health and feel better. Our goal has always been to make people feel better. So if we can make you feel better, that's what we want. Get you better, get you to feel better, get your life back to being, I don't like the word normal, but more normal, more manageable. So if that's it, it's been a pleasure. Thank you all for joining us, and I will let you guys go. Thank you very much.